There was a book on the market not too long ago, and the title of it was, I Hate My Neck. Caught my eye because guess what? I hated my neck too. What a difference it would make if it was just a little bit tighter. Probably take 10 years off of my appearance. So as luck would have it, I found myself in the office of a very well-known Beverly Hills cosmetic surgeon. I was there to pick up a friend who was unable to drive, and I was going to be the transport to take this person home. I asked him, if I was your mother, would you recommend to me that I do this? Because I hate my neck. He said, absolutely, you're a perfect candidate for it, assuming that you're in good health. So I, of course, went to my medical doctor, had all the tests done, came back with wonderful results, thank you, Lord. And next thing I knew, there I was on the table. One of the caveats of my going forward with this procedure was that I would not be under complete anesthesia. I did very well with a dreamlike state that they use as a very light anesthesia in colonoscopies. So I asked for that light anesthesia because I did not want to die on the table like poor Joan Rivers, who was on the table for cosmetic surgery and didn't make it. At the time, I remember thinking, how foolish to give it all up for that extra little polish. So this very simple procedure that I went in for, they did whatever cutting they needed to do and started to work on the other side. And the first side started bleeding again. So make a long story short, there was a lot of bleeding. They had to clean everything up, put me back together, and I had arranged to be in a nearby hospital for that rest of the day and overnight, just in case anything should come up. Well, that was the only smart part about the whole thing. Because as it turns out, this very healthy lady standing in front of you almost died. The nurse who was tending me woke me up at 2 a.m, having taken my blood pressure, which shot up to 220. You're supposed to be dead by that time. They reopened the clinic for me in the middle of the night, opened my face again, and I said, don't come near me with any anesthesia. I'm sure that whatever has happened to my blood pressure, Dr. Linda says, must have been the anesthesia. We're doing it without anesthesia this time. So he again opened up my face, stopped the bleeding, put me back together without anesthesia, which was no walk in the park, and I was sent back to the room with the nurse. That really is the end of the story because I was fine, I am healthy, I was healthy, but had I known that my children would be called to my side at 5 a.m. because they weren't sure I was going to make it, I would never, ever consider doing anything like that again. It changed the way I feel about all cosmetic surgery. That's a personal decision that one makes. But I just want you to know that just because you're healthy and just because the doctors agree you're a prime candidate for any kind of surgery that's elective, please give it a second thought. It can have disastrous results, and there's no do-over. This changed the way I feel completely about any kind of augmentation to what the good Lord has given me. I am no longer chasing youth because you know what? As I keep telling you, you can be anything you want to be in life except younger.